presenting on Kernicterus today. The main thing you should know about Kernicterus is that it is highly preventable. When I was searching online for information, I came across way more attorney pages than informational pages because doctors or other medical professionals can easily be sued for not catching such a preventable condition. Kernicterus is a neurological disorder that occurs when jaundice is left untreated. Jaundice is the buildup of bilirubin in the bloodstream, which causes yellowing of the skin and eyes. This buildup of bilirubin can spread to the brain tissue and cause irreversible damage to the brain. Bilirubin is a yellow substance that is created when our blood cells are broken down by the liver. Everyone needs it to help get rid of waste, but as you can see, too much of it can become very harmful. From what I read, there's little evidence about why this occurs, but once it does, the best course of action is to limit how much effect it has on the brain tissue, which I will explain more about in the long-term effects in just a little bit. Before that, here is a graphic that shows the progression from abnormal levels of bilirubin to it becoming excessive to when it becomes damaging. The first stage is really called hyperbilirubinemia, which is where the first signs of the condition can occur. It's a big word for basically meaning you have that abnormally high level of bilirubin in the blood, which then can turn to jaundice, which, if jaundice is not treated, becomes kernicterus. So here's just kind of a good graphic to show you that progression. First, it's important to recognize that the signs and symptoms of a newborn with this condition can be detected within the first 2 days of the baby's life. So it's really important to monitor them closely during that time. As you probably know, newborns really like to sleep, but if they're having difficulty waking, or when you're trying to talk to them and they just seem like their eyes are really droopy, then you know it's more than just sleepiness. And then when they are awake, they will let out a high-pitched cry or scream instead of just that typical cry for attention. So it'll be much more high-pitched. And then physically, it's easiest to tell that something is wrong because they may show that yellowing of the skin and eyes, and their body will look kind of floppy due to low muscle tone. Some things to consider that may mean that the baby is more susceptible to this condition is if they were born prematurely, if they're having trouble with breastfeeding, if they had any bruises or bleeding on the head, because of a difficult birth, or if one of their older siblings had to receive some sort of treatment as a newborn because of jaundice or related condition. The long-term effects of this neurological condition include uncontrolled body movements, specifically with the extremities. It'll be in the hands and feet mainly, but can be in the neck, even the tongue. Developmental or learning disabilities can occur, and then difficulty with eye movement, specifically looking upward, and then also hearing loss. So you can have vision or hearing loss as well. And then here's just another description of the condition with a paragraph that explains how highly preventable it really is, and then it describes a little bit of the treatment options, which I'm about to go over in the next slide anyways, but I just thought that this was a good graphic if you wanted to look at it to read that description again. The intervention that I would like to highlight mainly on here is phototherapy. I just think as future OTs, it was one of the most interesting treatments because it's directly related to the newborn's environment. In phototherapy, the client is placed under a blue light or wrapped in a fiber optic blanket that's also called a Billy blanket. It's used to treat skin conditions, seasonal depression, and cancer. It's important to note that phototherapy does not automatically mean a newborn has kernicterus, so your doctor's not automatically putting them under that blue light because they have that or it's already gotten to that stage. it's just a preventative measure that helps mitigate jaundice before it can become too severe. Some more extreme measures would involve the blood transfusion or a liver transplant to reduce that production of bilirubin. I also have a graphic on here to show the process of removing plasma and treating it before it's returned back to the body, which is just another treatment option to slow that production of bilirubin if needed. Because this condition can cause involuntary movement, some of the occupations that could be affected include feeding and eating, dressing, and grooming. These are areas that a therapist may want to help the client manage as they get older and become more independent. As a baby, those functional movements and hitting their developmental milestones would be the most appropriate area of focus. And then because this is a neurological disorder, the client may have cognitive deficits that would hinder their participation in school activities and social interactions. Again, these would be early interventions for the OT to work on before the client enters school age, and then continues with the client to promote success in those areas. I also put that the OT should consider that the client may have vision or hearing loss, which they would need to then look at the environmental impacts surrounding the occupations that I've already stated on here. And so that's just a few of the ones that I could think of, but I know that there is a long list of just ADLs, IADLs to look at throughout the lifespan for these kids. Now for a short quiz on what I've gone over with you today. Please write your response in the chat, and I'm going to go over those answers momentarily. So the first question is just, Kernicterus occurs when there are high levels of blank in the blood. Next is true or false. If brain damage can occur if jaundice is left untreated. And then lastly, which of the following indicates a need for immediate medical attention post-birth? I'm going to give you a moment to put these answers in the chat and see what you're thinking. All right, so thank you for participating. The first answer is bilirubin, which is the yellow compound created by the breakdown of red blood cells in the liver. So I hope that you got that right, because that's kind of the basis of Kernicterus and how it begins. And then next, it is true that jaundice is the condition that can lead to brain damage, because it is what leads into Kernicterus when it is its most severe. Lastly, the answer is all of the above, because yellowing of the skin, lethargy, and involuntary movement are all signs of a serious problem and would need immediate attention. Really, that's at any age, these are problems, but specifically for this condition, it would be in the first week of the newborn's life. So thank you for taking the time to answer those. These are my references, and thank you for listening.